Look at the nightstand beside your bed right now. Go ahead, take a look in your mind's eye. What do you see? Maybe a small orange bottle with a child-proof cap. Maybe a white plastic container filled with those little blue pills you take to help you sleep. You believe with every fiber of your being that these pills are protecting. You think they are keeping your blood pressure stable, your allergies quiet, or your nights restful. But what if I told you that every time you swallow one of those pills, you aren't healing your body? What if you are actually starving your brain? There is a silent thief living in your medicine cabinet. It doesn't break in through the window. You invite it in 3 times a day with a glass of water. And while you are focused on fixing your stomach or calming your nerves, this thief is slowly eroding the very thing that makes you, your memory. I'm not here to scare you. For no reason, I'm here because I've seen too many bright, vibrant seniors walk into my office convinced they were getting Alzheimer's, when in reality they were just suffering from the side effects of a prescription. My name is Dr. George Davis, and for 20 years I've been pulling back the curtain on what mainstream medicine often overlooks. I'm Dr. George Davis, and I need you to listen to me very closely. In my practice, I don't just treat symptoms, I hunt for the root cause. Too often the medical system treats seniors like a checklist of prescriptions rather than a complex living system. When you come to me with brain fog, the standard response is to write another prescription. But I stop. I look at what you are already taking, and 9 times out of 10, the cure is not adding more. It's subtracting the poison. Before we go deeper, I need to know who I am talking to. This isn't just for the algorithm. It's medically relevant for me to understand the scope of this issue in our community. I want you to go to the comment section right now. Type your age and the word awake if you have ever felt unusually groggy or forgetful after taking your morning medications. If you are over 65 and you've misplaced your keys more than 3 times this week, I need to know. This data helps me tailor future warnings specifically to your demographic. Don't skip this. Your input could save a friend's life. Now you might be thinking, Dr. Davis, isn't this just speculation? Aren't these medications approved by the FDA? That is a fair question. But approval doesn't mean safety for long-term use in seniors. Let's look at the hard data. A landmark study published in JAMA Internal Medicine followed over 15,000 participants aged 65 and older. They tracked these individuals for a time frame of 5 years. The results were chilling. The researchers found that seniors with the highest exposure to certain classes of medications had a 54% increased risk of developing dementia compared to those who took none. 54%. That is not a small margin of error. That is a crisis. Another study in the British Medical Journal showed that the risk increases with the anticholinergic burden. That's a fancy term I will explain in a moment. It means the more of these drugs you take, the faster your cognitive decline accelerates. This isn't anecdotal. This is statistical fact. And yet millions of you are walking around with this risk factor sitting on your kitchen counter. We are going to walk through 9 specific categories of medications that are commonly linked to rapid cognitive decline. I am not telling you to throw them in the trash today. I am telling you to recognize them, understand the risk, and have a conversation with your prescriber. We need to protect your brain. Let's start with the most common one. You can't sleep, so you go to the store and grab a bottle labeled PM. It might be a pain reliever with a sleep aid or just a standalone sleep capsule. The active ingredient is usually diphenhydramine. You know it as Benadryl, but in the sleep aisle, it's disguised as a restful night solution. Think of your brain like a busy switchboard. Acetylcholine is the operator connecting the calls that allow you to form memories. Diphenhydramine is like cutting the wires to that operator. It blocks acetylcholine receptors. When you block that chemical, you aren't just getting sleepy, you are shutting down the communication lines required for memory consolidation. You take the pill at PM, you sleep until AM, but when you wake up, you feel like you are walking through wet cement. You walk into the kitchen and forget why you are there. You think, I'm just getting old. No, you are chemically sedated. Persistent morning grogginess that lasts until noon, combined with short-term memory lapses like forgetting a conversation you had an hour ago. How many times this week have you woken up feeling more tired than when you went to bed? Comment groggy below. Ask your doctor about magnesium glycinate or melatonin as alternatives. Never stop cold turkey, but ask to taper off the PM ingredients. These are the heavy hitters for anxiety. They are powerful, fast-acting, and incredibly addictive. Many seniors were prescribed these decades ago for stress and have been on them ever since. Imagine your brain has a braking system to stop you from panicking. Benzodiazepines slam on those brakes. But they don't just stop the panic. They slow down the entire engine. They enhance a neurotransmitter called GABA, which calms nerve activity. but when nerve activity is too calm, your brain cannot encode new memories. It's like trying to write on a chalkboard while someone is shaking your arm. You feel a bit of stress before a doctor's appointment, so you take your little white pill. Later, your daughter asks you what the doctor said. You draw a blank. You feel embarrassed. You think your mind is going. But the drug wiped the tape clean before you could record the message. Confusion about recent events, difficulty learning new things like a new remote control, and a general sense of emotional numbness. Have you been on anxiety medication for more than 5 years? Type anxiety if you want more info on safe tapering. These require a very slow taper under supervision. Ask about risks or therapy which do not carry the same cognitive risk profile for long-term use. This is a sensitive topic, but we must address it. Leaking urine is embarrassing, so you take the pill to dry it up. But the cost might be your mind. These drugs are anticholinergics. Remember the switchboard operator I mentioned earlier? These medications are designed to relax the bladder muscle by blocking acetylcholine. But the bladder isn't the only place that uses acetylcholine. Your brain uses it for thinking. When you take this pill, you are drying up your bladder and drying up your brain's chemical messengers at the same time. You plan your day around the bathroom. You take the medication. You stop leaking, which is great. But 3 months later, you realize you can't remember the names of your grandchildren as quickly. You blame aging. The medication is the culprit. Dry mouth, dry eyes, and constipation often accompany the memory loss. If you have all 4, the anticholinergic burden is high. Do you suffer from dry mouth along with memory issues? Comment dry below. Ask about mirabegron, which works on a different pathway that doesn't affect the brain. Pelvic floor exercises are also a drug-free alternative. You have heartburn or acid reflux. It burns, so you take the purple pill. It's one of the most prescribed drugs in the world, but long-term use is a major red flag for seniors. Your stomach acid is there for a reason. It breaks down food so you can absorb nutrients. Specifically, it helps you absorb vitamin B12. Think of B12 as the insulation on your brain's electrical wires. Without enough acid, you don't absorb B12. Without B12, the insulation wears off and the signals slow down. This mimics dementia perfectly. You've been on the reflux med for 3 years. You start feeling tingling in your feet and forgetfulness. You worry about Alzheimer's. But really, you are just malnourished in one specific vitamin because your stomach is too neutral. Fatigue, weakness, and memory confusion that comes on gradually over years of use. How long have you been on heartburn medication? If it's over 2 years, comment reflux. Ask to try an H2 blocker like famotidine instead, which is gentler. Get your B12 levels tested immediately. These are older generation antidepressants. They are sometimes used for nerve pain or sleep in seniors because they are cheap and effective. But they are dirty drugs, meaning they hit many targets, not just the one we want. Like the bladder meds, these have strong anticholinergic properties. They block the memory chemical, but they also block histamine and adrenaline receptors. It creates a chemical fog over the cerebral cortex. Imagine looking through a window that hasn't been cleaned in 10 years. You can see out, but everything is blurry and distorted. You take this for back pain or mild depression. You notice you don't care about your hobbies anymore. You feel flat. You can't focus on a book. You assume it's depression returning. It might be the medication suppressing your cognitive drive, apathy, lack of motivation, and significant difficulty concentrating on tasks that used to be easy. Do you feel a lack of motivation despite taking meds for mood? Comment flat below. Newest RIS or SNRIS generally have a lower anticholinergic burden. Discuss switching with your psychiatrist. Your back hurts. Your neck is stiff. You take a muscle relaxer to get through the day. These are essentially cousins to the antidepressants mentioned above. These drugs work on the central nervous system to dampen nerve signals. They tell your spinal cord to stop telling your muscles to spasm, but the signal dampening doesn't stop. At the spine, it travels up to the brain. It slows down the processing speed of your neurons. It's like putting a speed governor on a car. You can't go fast even if you need to. You take the pill for a pinched nerve. You feel physically looser, but mentally you feel like you are underwater. Conversations feel like they are happening in slow motion. You miss punchlines of jokes because your brain processed the setup too slowly. Dizziness, lightheadedness, and a feeling of mental slowness or brain fog. Have you felt dizzy after standing up quickly while on these meds? Comment dizzy. These should only be used for short bursts, 2 to 3 days, not chronic management. Physical therapy is a safer long-term solution for chronic pain. Now, this is controversial. Sometimes these are prescribed off-label to seniors for sleep or agitation, even if they don't have psychosis. This is a dangerous practice. These drugs alter dopamine and serotonin levels significantly. In an aging brain, dopamine is already in shorter supply. It's the fuel for your movement and your motivation. When you block dopamine receptors, you starve the brain's reward system. It can lead to Parkinsonism symptoms and rapid cognitive decline. A loved one is agitated at night, so the doctor prescribes a low dose to help them settle. They sleep better, but over 6 months they become withdrawn. They move slower and stop recognizing family members. The drug treated the behavior but accelerated the decline. Tremors, stiffness in movement, and social withdrawal is a loved one on medication for agitation. Please comment care so we can discuss safer alternatives. These should be a last resort. Environmental changes and routine adjustments should be tried first. Always ask, is this FDA approved for this specific use? If you have Parkinson's, you need medication. But some of the older drugs used to treat tremors work by blocking acetylcholine to balance dopamine. It's a balancing act. Too much acetylcholine causes tremors. Too little causes memory loss. In seniors, the brain is less resilient. Tipping the scale to stop the shake can stop the thought. It's like fixing a leak in your roof by removing the ceiling. The leak stops, but now you have no ceiling. Your hands shake less, which is wonderful, but you find yourself unable to follow the plot of a movie. You lose the thread of conversation. The trade-off for physical stability is cognitive instability, hallucinations or confusion that worsens after a dose increase. If you manage Parkinson's, have you noticed confusion with tremor control? Comment Parkinson's. Newer dopamine agonists may have less cognitive impact. Work closely with a movement disorder specialist, not just a general practitioner. Chronic pain is real and it needs treatment, but opioids are a double-edged sword for the senior brain. Opioids bind to receptors that control pain, but also receptors that control breathing and alertness. They lower the oxygen saturation slightly and depress the central nervous system. A brain that is slightly oxygen-deprived and chemically sedated cannot fight off plaque buildup. It accelerates the aging process of the neurons. You manage your arthritis pain with a patch or a pill. You aren't in pain, which is good, but you spend most of the day napping. When you are awake, you feel detached. You aren't living. You are just existing. The pain is gone, but so is your spark. Excessive daytime sleepiness, constipation, and pinpoint pupils alongside memory gaps. Do you nap for more than 2 hours during the day? Comment nap. Explore non-opioid pain management like topical creams, nerve blocks, or anti-inflammatory drugs that don't cross the blood-brain barrier as easily. I know that was a lot to take in. You might be feeling a surge of anxiety right now. You might be looking at your pill organizer with fear. Stop. Take a deep breath. I did not share this to make you panic. I shared this to give you power. Here is the good news. The brain is resilient. Neuroplasticity doesn't stop when you turn 60 or 70 or 80. In many cases, when these medications are tapered off correctly, the dementia symptoms reverse. The fog lifts. The memory returns. Your body wants to heal. It has been waiting for you to remove the obstacle. By identifying these triggers, you are not admitting defeat. You are taking the first step toward recovery. You are reclaiming your mind, the fear you feel right now. Turn that into action, not reckless action, but informed action. Let's summarize what we've covered today so you can take this list to your next appointment. Avoid diphenhydramine for chronic use in sleep aids. Benzodiazepines increase fall and dementia risk for anxiety. Anticholinergics for bladder issues block memory chemicals. Proton pump inhibitors for reflux can block vitamin B12 absorption. Older tricyclic antidepressants have high cognitive side effects. Muscle relaxants cause central nervous system depression. Antipsychotics are dangerous for off-label sleep use in seniors. Some Parkinson's medications balance tremors by sacrificing memory. Opioids depress the brain's alertness and oxygen use. You now know more than 90% of people your age about the hidden risks in your medicine cabinet. Most seniors trust the bottle blindly. You now have the knowledge to question it. Knowledge is your shield. I want you to think of one person you love right now, a spouse, a sibling, a best friend. Think of their face. Do they struggle with memory? Do they have a nightstand full of pills? Share this video with them. Do not let them walk into the dark alone. Click the share button and send this to them today. It might be the most important thing you do for them this year. In the next video, I am going to talk about the 3 specific supplements that can help repair the damage caused by these medications and support your acetylcholine levels naturally. You won't want to miss that. Click the video on the screen to subscribe so you get notified the moment it goes live. Never stop taking prescribed medication without consulting your healthcare provider. Sudden withdrawal can be dangerous. Always work with your doctor to create a safe tapering plan.